And hey everyone. Well, because of my line of work, I started involved in this wonderful the CNS, the central nervous system drug. Well, today I want to explore the use of a paliperidone, the intramuscular injections, for treating the schizophrenia. Well, it's a product from the J&J. This method offers a more convenient alternative to daily oral tablets. The patients, typically consume around 356 tablets, annually every day. But with the paliperidone injections, the frequency reduces significantly while enhancing the patient compliance. The aim is to transition from daily oral medication to less frequent intramuscular injections, or either every 4 weeks or every 12 weeks. This change can reduce the annual administrations to just 12 or 4 times, respectively, well, depending on whether we use a 4-week or a 12-week regimen. J&J has two formulations of paliperidones. And first one is Invega Sustenna for 4-week administration. And the other one is Invega Trinza, which is for a 12-week administration. The dosages for Invega Sustenna vary, including 39, 78, 117, 156, and 234 milligram. The treatment initiation with Invega Sustenna typically starts with a higher dose to establish the therapeutic levels quickly. And after the first dose, and the subsequent injection is given at 1 week and after, and at a reduced dose, followed by a maintenance dose every 4 weeks. Paliperidone allows for a direct transition from the oral to injectable form without the need for what we call the oral overlap. Once the patient switches to the injectable form, and then the oral tablets are discontinued entirely. Well, after the maintaining stability on the Invega Sustenna for 4 months, then patients may transition to Invega Trinza, which is administered every 12 weeks. The dose for the Invega Trinza is calculated by multiplying the maintenance dose of Invega Sustenna by 3.5. The dose adjustments for Invega Trinza are based on the patient's response to the Invega Sustenna, with available dosage including 273, 410, 546, and 819 milligram. The treatment process begins with the initial and higher dose, same as Invega Sustenna, followed by the dose reductions and stabilization. Well, once stabilized, the patient can switch to the Invega Trinza, further reducing the frequency of the injections. So the switch to Invega Trinza is considered when the patient has been stable on the 4-week regimen for an adequate duration. Well, typically 4 to 6 months, while ensuring a stable transition to the 12-week regimen. Dose selection for Invega Trinza is patient-specific, while considering factors like the kidney function. The lower starting doses may be used for patients with the renal issues, with the subsequent adjustments based on the tolerance and the response. Well, it is crucial to know that no oral overlap is needed when transitioning from oral paliperidone to its injectable forms, while simplifying the treatment regimen and the enhancing the patient adherence. Thank you for watching this overview of paliperidone intramuscular injections for treatment of schizophrenia. Thank you.